Thank you for coming to the Living Well Seminar. I hope those of you who are here for the first time will come back. The Living Well Committee, which is an HOA committee, brings in people to talk about things that make our lives better, physically better, and mentally better. So you should always watch for your emails. If you get an email about the Living Well Seminar, consider it, because they're the very best people to come up and talk to us about things that will make our lives better. So keep that in mind as you look at the emails coming to you. Now today, I get to talk because I actually know what I'm talking about for a change of pace. I can show you the scar this man put on me. We would all be embarrassed, so I'm not going to do that.
Thanks.
So, this is Dr. David Shau. He is an amazing doctor. You'll hear more about that. You'll see that in the lead. He's going to talk today about joint care and its impact on mental and your overall health. And Dr. Shau is a native Texan. Was born in Fort Worth. He went to high school in Flower Mound. He went to the University of Texas at Austin, in case you wanted to know. He then left Texas to go to other places to get his experience, academic experience in orthopedic surgery. He was at Vanderbilt. I understand, according to your internet information, magna cum laude, Vanderbilt Medical School. Pretty impressive. He went to Emory and studied there. He went to University of California in San Francisco before he came back to Texas. Now he works, and he was recruited to join one of the largest and long-standing orthopedic groups here in Texas, called the Texas Hip and Knee Center, which is down, their main office is down in South Fort Worth, but Dr. Shau has an office in Keller as well. He's built his practice through connecting his community to quality service, and I can attest to that, and delivering excellent patient outcomes. I can also attest to that. As a result of his dedication to his craft, he's been recently promoted to fellowship co-director there at his office. There is information about Dr. Shau on the website. Just recently, he became an adjunct professor at TCU. He is a physician's development coach, and I didn't ask him if he's got paid as well as a football coach. He said the answer is no, but that's another story. So, well, I'm here to tell you, listen up. This man will tell you the facts, give you the straight information. His wife is coming. She is his chauffeur today, and his lovely daughter, Margaret. He came from surgery to get her, so he's dressed appropriately, and he didn't go to surgery. And I understand they're going to wait for him to start. So he'll be there, and when he gets there, that's when they'll start the surgery. So, thank you, Dr. Shau. Go
Thank you. Well, I'm very honored to be invited to this community. Ms. Dawn, thank you so much for that introduction. And I'm super thrilled just because part of the community. Harper girl is second generation now. She's Fort Worthian also, born in Fort Worth, and we're thrilled to be here. And thanks to my wife for supporting me through all this, with her being born. And she's able to support me at home while I take care of patients, and she's part of that team. And thank you again. I hope today's topic is joint health and its impact on your mental health and overall wellness. But the goal really is to explain things about joints and why that matters and how it's all connected. And hopefully find it at least entertaining, if not somewhat educational. I'm going to start off with trivia. So do you guys know how many bones are in a human body? Any guesses? Any numbers? You can throw out any numbers. Getting close. 206. Very, very close. Very close. All right. How many joints are in the human body?
150.
All right. 360.
Oh, wow.
A lot of joints in the body, okay? So this hopefully woke you up a little bit, morning or afternoon, whatever we are now.
Yes.
But today, we're going to talk about this. So the different outline, different sections here. We'll start off intro, go over some basics. We'll talk about how joint health is related to your wellness, how to keep your joints healthy, how do joints break down, and when it starts hurting, what do you do about it? So section 1, introduction. I'm going to have little pictures of baby Harper there just to keep her engagement throughout this process, this post-lunch process. And so some disclosures, things that you probably already know, but I'm employed orthopedic surgeon with Texas Hip and Knee Center, the part of Texas Health. We operate primarily out of Texas Health Clearfork. I'm also employed by TCU. I don't get paid as much as the football coaches. I'm a physician development coach. I'm in both the departments of education and departments of surgery there. So I work with mentoring students, coaching students, and it's been an honor to be a part of that group. But everything in this content is that of my own advice, and it's not meant to be medical advice. If there's medical advice, everything's specific to yourself. So it'll be better to discuss that with me in person so that I can examine and go over your case specifically. A little bit about me. Ms. McDonald hit on a lot of things kind of from around here. There's my wife over there, baby girl. A lot of things here. You see Marcus High School right down the street in Flower Mound. I grew up playing sports, playing drums, being involved in different things. Medicine was a calling. My parents never forced me to go into medicine. I was fortunate enough to go study engineering and subsequently develop an interest in medicine, specifically orthopedics and joint replacement. And about that journey, when I went to UT Austin, studied biomedical engineering. I did a summer internship down in Houston. The first surgeries I've ever seen was knee replacement. So when I was studying about CAD drawings or these different engineering designs, biomaterials, and then I saw that applied in the surgery room and heard, you can make somebody really better with this technology and this device. I thought, how can I make this into a career? That's where I really found my calling. Went to Vanderbilt, did my MD and MBA degree there. Then went to Emory, where I did my orthopedic surgery residency. I also did a healthcare management residency. I really want to learn how to piece together everything. It takes a team, it takes a village, it takes a community. So that's why I wanted to learn all that. Then I did a deep dive, a 1-year dive at UCSF, where they're the highest NIH funding orthopedic group in the U.S. I really learned about joints. My chairman was a joint surgeon, and really figured out, how can I be the best joint surgeon I possibly can be? And I'm fortunate enough to be here now. These are some pictures of some of my mentors throughout the whole training process. I wouldn't be here without great surgeons teaching me and modeling how do you take care of patients, how do you care, and how do you problem solve, how do you think about situations, address things as they come up. Section 2, we're going to start with basics. That was a little bit about me, now we're going to start with basics. And Harper's really into this presentation, I can tell. And so, brief anatomy. So cartilage. What is cartilage? They're at the ends of the bone, and they're different. They cover the joints. Excuse me, I meant what are joints? And you can look at this skeleton here. All types of joints. There's ball and socket. There's hinge. You just think about your body. There are ways you can pivot, rotate your fingers. Your thumb moves in a different way than your other fingers. How your hip moves is different than how your knee moves, and that's different than how your ankle moves. So all these different joints, they call pivot, hinge, saddle, plane, convoluted, ball, and socket. There's also different sizes. The smallest size is in your ear, believe it or not. You have joints in your ear. That's how you can hear. And all these joints serve for different functions, okay? And that's kind of the first brief overview. And then furthermore, this is very basic bird's eye view, but there's muscles and tendons that cross the joints, okay? And these joints are covered by synovium and capsule. These are soft tissue that outline the joints. These joints are also bathed in joint fluid that allows for lubrication, allow your joints to move. And then the joints are lined by bursal tissue. As you can imagine, if something is to move, you need something to help glide. And that's what bursa is. You might hear bursitis, for example. And that's where I go into not all pain in your joints the same. So you have to figure out, why is your joint hurting? Is your joint hurting because of the muscles and tendons? Is it because of the capsule or synovium? Is it because of the joint fluid or something in the joint fluid? Or is it because of the bursa or the lining of the joint? The functions of the joint. So, as you can imagine, the muscles and tendons go in the joint, they fire and they pull. So they're able to allow you to function, allow you to move, and it generates force, allows for movement. And then they also serve as shock absorbers. These joints, every time you walk, you can imagine there's a lot of force going to your joints. Well, how can you dissipate that force? Okay, the cartilage cells help you do that. On top of that, meniscus and labrum also help you do that. So some of the pictures right here you can see in the center, that just shows you the arrows that kind of spread out the force versus big arrows just isolated in a certain area. When you have damage either to your meniscus or cartilage, oftentimes that affects the force and joint reaction forces to your joints. And when that happens, things of that could happen in the top left. The shock absorber doesn't work anymore, entire bus free. You want to be like a race car and be able to keep on functioning at a high level. And then there are lots of studies about this. There's different force vectors, okay? Whether it's playing golf, I know the golf course is right around the corner there. There are studies on that, how these forces react, and every time you try to do a certain activity level, what the impact is on your joint. And then they can get really complicated really quickly. I have that picture there just to show you. There are textbooks written about joint reaction forces. And when we think about joint replacement, when we think about your joints, we think about how these forces impact your function. Back to trivia, because that was a lot of textbook talk. What are the two largest joints in your body? Hip knee. Oh yeah, you guys got it. Hip and knee joints. That's right. Hence, I work with Texas hip and knee. So those are all the two biggest joints in your body, and they provide a lot of function. You can imagine anytime you walk, that's what you need. Now, section 3. How is joint health related to my wellness? Well, this little arrow kind of summarizes it for you. Okay. Your joint health is super important because that allows you to function. All the different things we're talking about functioning with the muscles firing on your joints to move, that allows you for mobility. Well, mobility allows you to exercise and do things you enjoy, such as playing golf, such as going on vacations or going on tours. And that impacts your cardiovascular health. Cardiovascular health is super important. That's your whole body, right? That also impacts your metabolism, how fast you're burning calories and fat. And then subsequently, that impacts your energy. How much energy do you have in a day to go about your business? How much energy do you have to interact with your family, your friends? And then because of that, it impacts your general health, right? Like your blood pressure, your cholesterol, all these other things that you hear about. Other things are when you exercise, when you're able to get around, be with family, be with your community, you release endorphins. And that makes you feel better. That makes you feel happy. And that impacts your general wellness. So now you can see by the simple arrow of this leads to this, leads to this, leads to that, joint health is the beginning of it, right? And that all the way triggers down to your wellness, okay? And so thus, maintaining your general wellness makes you happier and healthier. And you're able to do things like that, ride horseback, play with grandchildren, hang out with your community. And lots of studies have been done on this, okay? Patients with arthritis have been shown that depression scores and quality of life measures can be lower. Why is that? Well, because of that pathway, right? So if you don't have that pathway, it can impact your wellness. Now, section 4, how do we keep your joints healthy? Because I think we just talked about what joints are, how joints function, how do we keep them healthy? Well, motion is lotion. That's a quote that I like to use. Your joints like to move. If your joints don't move, they get stiff. Then they start hurting, okay? And then it becomes this spiral. So how do you keep it, how do you have motion? Well, exercise and stay active. But you can do this and avoid high impact activities, right? Running, jumping, those are things you probably heard. Hard to do, okay? But you can do things like closed chain activities like body weight squats or even just lunges, chair exercises. There are a lot of different things I'll show you a little bit that you can do. Avoid gaining weight. The more weight you gain, the bigger impact it has on your joints. And it makes it harder to then exercise and do things you want to do. And then it goes down that spiral that we kind of talked about. And we do a little trivia. True or false? Gaining 10 pounds of weight can feel like 30 pounds of weight to your joints. Yeah. There you go. That's very true. Now, how do you calculate that? Well, let's do some calculation. Every pound is actually 3 to 4 pounds to your joints. Okay, that's per step, right? So if you take, let's say, 5,000 steps a day and gain 10 pounds, let's just underestimate. Let's say it's 3 pounds per step. That's extra, or 30 pounds. You multiply that by the 5,000 steps. That's $150,000, 150,000 pounds extra of weight that you're experiencing per day, per joint, right? Per knee or per hip. So that's a huge jump. So just losing some weight can help you oftentimes. She agrees. Motion is lotion. So these are all different things that can allow you to do activities that, again, not high impact, but allows you to move your joints. Allow that motion part, okay? I'm going to read this out loud because a lot of these things you can do in your community here. That's what's amazing. Just seeing this area, you can do a lot of these things. Walking, hiking, cycling, biking. Now, bike can be stationary or it can be outdoors. Elliptical, stairmasters, rowing, water exercises, golfing, ping pong, tai chi, yoga, stretching, weightlifting. These are a lot of activities that you can do and find ways to do even in this community here. And you can find ways to stay active even if your joints are hurting, because that's a common question I get is, well, what can I do? My joints hurt. How do I stay active? And you don't even have to be that creative. There are a lot of different resources. Some pictures here can show you, even sitting down, even in a chair, you can do a lot of body weight type activities. If your joints hurt, if your knees and your legs hurt, you can do arm exercises, right? You can do resistance bands. You can hold onto a chair. These are all different things that you can do. Again, motion is lotion, so keep active, keep that motion going. Don't just sit there and let things stiffen up and hurt. I often get the question of, well, okay, I'm doing my motion, I'm doing everything I can, I'm trying to stay active. What else can I do? Right, that's the question I often get. What else can I do? Can I do supplements? Will that help me stay healthy? A lot of these supplements you've probably heard of, because people ask me about chondroitin sulfate, glucosamine, fish oil, turmeric, cherry extract. There are many others. There's too many to list, really. The question is, there are good literature out there to support one or another. Okay. The reason being is there's no control over the formulation of these compounds. We also don't know bioavailability. My wife's a pharmacist, so she knows all this stuff in terms of absorbing. You take a medicine, well, how much is your body actually taking on? And what's actually in the medicine, and how much is it in there? A lot of the actual medicines that you have, they're regulated, so they get processed, say this is how much needs to be in each one, and how much your body takes up, and there are studies on it. With all these supplements, they're not. Now, I do want to make a call out to my fellow. This is Dr. Alan Putty. He's been doing blog posts for us on our fellowship website. So he did a little article about this. So if you want to read more, there's a link that you can read more about what he has to write. But he's Air Force. He's been deployed in Afghanistan. He's been a general orthopedic surgeon for a while, and he's taking a year out. His family still lives in Colorado Springs, but he's taking a year out to learn from us at Texas Hip and Knee. And so this is a testimony to our group, I would say. Other things are holistic approaches. Acupuncture, chiropractor, PT, doing modified activities like yoga, water aerobics, arm cycling, and then having mindfulness, community, and spirituality, whether it's church or just your community here. That's super important because it's all part of your wellness. This all factors in, your joint health all the way to this. These are all different ways that you can stay together and feel better. And patients often say, you know, well, I don't want to do that. I just want medicine to cure me. And that's not the case when it comes to joint health and overall health. Don't let just the medicine cure you. You want the whole community, and you want to be able to do things you enjoy, and whether that's the community or your family. Another trivia there, kind of give the answer away. True or false? Supplements and vitamins are FDA regulated and have consistent production standards. False. That's right. They're not regulated. You have no idea. So they may say, oh, this is glucosamine. You don't know how much is in there. You really don't. And then you don't know how much is actually getting taken up by your body. So that's tricky. There are good studies out there. They're not randomized control. And then even if they do randomized control, they don't know the formulation of what they're controlling or they're giving out. Section 5. Okay, now we're getting to some of this might hurt more people's attention now. How do joints break down? Well, I like to give the analogy of a tire wear. Okay, you can see the picture on the left over here, from a new tire threads all the way to no tire threads, being almost a bald tire there. Okay, now this process happens both biologically and mechanically when it comes to your cartilage. Okay, what do I mean by mechanical? I mean that it's wear and tear, just like the tire. Unlike the tire, there's also biological. Your cartilage is made up of cells. These cells secrete lubrication and also helps you move. When that starts breaking down, the composition of cartilage is mixed up. So the water to the protein-glycan ratio, for example, is no longer the same. The amount of cushion it can provide is no longer there. And subsequently, it starts wearing out. Okay. Some common causes of joint disease are these listed here. Just normal aging. Okay, just normal wear and tear. You can have osteoarthritis. That's when it's becoming more notable, where your cartilage is actually starting to wear out. It can be post-traumatic arthritis, right? I have patients who they either were in a car accident or sporting accident or had prior surgery. that can trigger that cascade also. Then there are other things like rheumatoid or inflammatory arthritis, other diseases of the joint that can cause worsening over time and causing that wear and tear or expedited. Sometimes there's different patterns to wear and tear. So us diagnosticians, we can look at x-rays and tell you, you have this one or that one, or you may have this one, and how to diagnose that and provide treatment options. Don't focus too much on this. It's a busy slide, but that picture tells you it gets complex about how the cartilage works, how the biological environment works, and how it interacts. What I'm trying to tell you is when you have arthritis, these pathways are no longer normal, right? And these pathways can signal pain, can signal inflammation. When you have inflammation, it can swell, it can hurt, it can really limit you. And so when I go back to how do joints break down, well, a lot of these different pathways here can go awry, right? And so it's important to know that it's a multifactorial thing, and it's hard to say. Because patients also say, well, my parents had it, so does that mean I'm definitely going to have it? Not necessarily. It's not full penetrance, but there is a genetic component to this. There are twin studies that says twins will more likely have it than non-twins, but then you'll have a lot of twins that one may have it, the other one may not have it. So those are all interesting things about arthritis and how your joints function and how they break down. Trivia. According to the CDC, what percentage of adults in the U.S. have arthritis?
5%.
What do y'all think?
24%.
24%. Bingo! You got it right. There you go. That's at least the 40. This is probably underestimated, right? Because they only do a limited population. It's not everybody, but you're absolutely right. In certain communities, I bet you that number is even higher. Right? Exactly. All right, section 6. Now we just went over what joints are, how joints function, how that impacts your life and wellness, how joints break down. Now we're going to go over what should you do. Now they're starting to hurt. Let me give you a multiple choice first. A, hit it with a hammer, WD-40, duct tape, ignore it like those pesky spam calls. Well, answer is D. You can start with rice. Okay, rice is rice, ice, compress, elevate. Then you can monitor, modify, and then make that call if you have to. Okay, that's the answer there. So using common sense is the first step. How bad is this actually hurting you? If it's something that you tweaked it over the weekend, you overdid it, we'll start with rice. Okay, resting, icing, compressing, elevating. Just take it easy. Let your body, compensate for that. And then if you figure out an activity that makes it worse. If it's an activity that you can avoid, try avoiding it, okay? But don't avoid at the expense of your wellness and your ability to stay healthy. And then, if that doesn't work, if you use your common sense, you use rice, then you start thinking, do I need to go see a healthcare provider to make sure there's nothing else, okay? You want to nip it in the bud. Do not allow the negative spiral. What is that negative spiral? That's your joint hurts. You don't exercise, you don't move, then you don't have good cardiovascular health, then you don't have good general health, then you have a hard time going to your community, you have a hard time seeing family, you have a hard time doing activities you enjoy doing, then your overall wellness goes down and you're less happy, okay? Those are all the things that negative spiral. And because of that, your joints get stiff. Because your joints get stiff, they start hurting more. And that's that spiral you want to avoid, okay? Stay tuned. There are more lectures that I can always give on what to do. But the key is diagnosis. You have to make sure why your joints are hurting. Not remember, beginning of talk, all these different things that can cause joint pain, right? We can help diagnose that. Providers can. If it's bad enough, we have to figure out, is this a bursitis? Is this, you have gout? That's a joint fluid issue. Is this because you have tendonitis or tendon swollen? Is this because of arthritis, because your actual joint and cartilage is being worn out? You can hear just that there are so many different causes and potential causes of joint pain. That diagnosis is key, because diagnosis then drives a treatment plan, okay? Not all joint pain are the same. We also have to figure out, is this a local thing or is this a systemic thing? And we also figure out, is this acute or chronic or acute on chronic? So there's all these different things that we look at. It can get complex really quickly. Because of this complexity, you have to be careful, because there are always people who try to take advantage of the situation. Okay, so be careful, snakes, oil spills. If somebody tells you, this is going to do it, no problem, bar none, you always got to wonder a little bit. But I think that's what's great about this community. You can talk to your peers, talk to other people, know what works, what doesn't work, or who to trust, who not to trust. Navigating that water can sometimes be tricky. I myself always think about that. If it's something I'm not familiar with, if I go to a car mechanic, I don't know anything about engines, and I have them look at an engine, how do I trust them? But having a community like this where other people have gone through the works, then you can trust that more so. But be careful of some of those folks out there. I'll give you some example. Stem cells. Those don't really work for arthritis, okay? Why? Well, stem cells, well, number one, where are they getting the stem cells from? Okay, they might say, I'm going to get it from your fat tissue, we're going to spin it down and try to get some of that fat tissue or get stem cells from that. Well, how do you know that stem cell is going to behave what you want it to do? Number one. Number two, you're going to put it in your knee joint, let's say. Well, I just went over all that pathway with you, didn't I? That pathway is confusing and there's a lot of different things going on. How do you expect stem cells to then activate that process and get you normal again when the cells are already abnormal? So you have a hard time getting normal cells to do it. How do you get abnormal cells to do it? And so that's ultimately my question. There may be a role in that in young athletes, in young patients with cartilage damage that otherwise has normal cartilage. I agree. There may be a potential for stem cell in that situation. Right now, at this day and time, stem cells not evidence supported. Okay, so that's just an example of being careful what's out there. At Texas Hip and Knee, we don't offer stem cells because we know that doesn't work. Right? Some places might offer because they'll say you can pay cash and do it. so just be mindful of that, okay? Now, your doctor will want to know a lot of questions about your joints. He'll ask you when it start hurting, how did it hurt, what's your history, does it wake you up at night, where does it go anywhere else? A lot of these questions we ask you, we're trying to figure out the diagnosis, okay? We're also trying to figure out is it coming from the back or the spine, because that can also happen. Regardless, oftentimes we get these new patient paperwork, and that does help us because we do review that and figure out what else is there that we need to consider. But most importantly, we talk to you guys. We want to talk to you. We want to talk to the patient, hear from them. Picking your doctor is super important. You have to find the right doctor, okay? And what do I mean by that? You want to find a doctor that you trust. You also want to find a doctor who has the skill set and training, right? A lot of the patients that we do at Texas Hip and Knees, sometimes they haven't done it, someone else in the community. What happens then is the community surgeons, and this is not their fault, but they're not fellowship trained, or they may not have the appropriate support or infrastructure or even facility to take care of complex joint issues. And you don't know where you fall in that spectrum, right? You don't know if you're a complex joint or not. Whether it's deformity, whether it's the softness of your bone, whether that's your alignment, whether that's just your anatomy. Those are all different things that we consider. And if you don't have the training or expertise, you don't even know what you're not knowing, right? Things to avoid, okay? You want to avoid unnecessary tests. You want to avoid, deciding, a big decision without thinking about all the facts. I always like to say, I want to make sure we leave no stones unturned. I want you to understand what you're about to go through. I want you to understand what the process looks like. And then I have a staff that allows us to do that. I have a great nurse, Joel, I think some of you know. But not just her, our whole staff is well tuned to knowing that. So these are all a little bit of things that you want to think about. Who's right for you, which doctor, what type of facility, what does that look like to you, okay? And just a little bit to brag on my group, we are one of the biggest, actually we are the biggest subspecialty hip and knee group in DFW, bar none, okay? In fact, we're one of the highest volumes in the country, all right? And I know this now because I'm a fellowship director and I have applications coming in from all over the country. The different vendors tell us that they're very interested in doing studies with us and better understand things. We have over 170 years of combined experience. That's hard to say, in a big group, and that's very rare. It's hard to find that around here. We have surgeons in every generation, 30s, 40s, 50s, 60s, and 70s. That's across the whole spectrum. We use robotics, we use technology, we use a lot of different things, and we assess them. We help assess, is this industry standard or not? We train future surgeons, and we also mentor TCU students. We're always thinking about how can we be better, okay? How do we take care of our patients, take care of our communities? The reason we've been successful and continue to grow over all these years is because we have that culture. It's the whole group is that culture. It doesn't matter if one surgeon leaves or one surgeon goes somewhere else. We have that culture, we have that mentality, and that's what we want to continue to do in the future. And then here are a few things. Think about the surgery of the hospital, right? There are a lot of hospitals probably closer to you, but they may have surgeons there that do other types of surgeries, whether it's GI or OB-GYN or anything else. Where we operate, it's a subspecialty hospital. It's only hip and knee surgery with some spine, some other orthopedics. The majority, 95%, is hip and knee. That's super important. And I say that because, I give this example to my patients. If you want to eat French cuisine, you don't want to go to someone who only makes French food once every however long. You want to go to a French restaurant that everyone does French cuisine, right? So you have the waitress, the waiters, the sous chefs, the cook, everybody is all about French cuisine. Yeah, and so that's what Texas Hip and Knee is, and that's what doing our surgery at Clearfork does, is that we're hip and knee subspecialized. You want to be high volume, so there's nothing that catches us by surprise. We see that it's hard to be surprised by certain things because we do so many and see so many, and we have things ready. Okay. The other thing that's with Texas Health Clearfork, they have a lot of recent accolades of being on U.S. News Report, all these awards that they got, which I'm not surprised by. I think we're probably one of the best kept secrets in the nation, I'd argue to say. When I was applying for fellowship, I didn't know Clearfork existed. I didn't know Texas Hip and Knee existed. I told my group, that's a shame. People ought to know about this group because we do good care. This is a picture of Texas Health Clearfork. It's right by the Trinity Trail. It's right by the Trinity River. You can see it there. It's right by the Chisholm Trail. That's a nice facility. There's restaurants and different venues around that area as well for your family while they wait.
Is that in Dallas?
That's in Fort Worth. Yes, ma'am, Fort Worth. And so that's in the summary. There's supposed to be another picture of Clearfork there, but for some reason it didn't show up. It's just a white space. Sorry about that. But essentially, it's a nice facility, and it's a place for you to heal and get well. It's not a place it's not sick patients there. Everybody there is cleared to have orthopedic surgery, so that you can focus on getting well. The whole course will have a medical doctor there that's in-house that's available. We have physical therapy present, and we have case manager present. So everything's geared towards you, okay, and getting well. A bit of teasers, and I talked to Mr. Mary Tim about this a little bit. If wanted, there are other topics. Today we talked about joint health, impact on mental health, and general wellness. But there are a lot of other topics I think that might be interesting, okay? I'm going to read it out. You must do this before scheduling joint replacement surgery. I think those are some questions that some people are like, what am I supposed to do right before I schedule? Other questions are, just do a deep dive in both knee replacement and hip replacement. What are the factors that we think about? What are the things that's involved with this? How can I keep my replaced joint healthy? A lot of folks here I know already have joints replaced. What do you do to keep it healthy? What do you do to keep it going? What are some red flags you have to think about? And then, what's the past, present, and future of joint replacement? Since we are at the forefront as a group, and myself, my interest in the teaching side, what's the future like? What about robotics? How does robotics play a role? How can robotics be utilized to make things better? What is robotics? What is that? So these are all things I'd be happy to talk about at a later date. But today, my goal, hopefully I accomplished it, but hopefully today I can encourage everybody here to say, take control of your joint health, okay? Because that's so important to your overall health and your wellness. There are some trusted resources here. It's a little hard to read, but I'd be happy to send to Ms. Lagana or Mr. Barrington. But these are websites from the Board of Orthopedics and our subspecialty professional group. Lots of resources online. You just have to know which ones to trust, which ones to look for. Thank you so much. I hope you found it useful, at least a little education. Yes, absolutely. Please, I want you guys to ask a question. I have about 10-15 minutes. I do have a surgery I have to go to in a little bit. But I want to engage everybody here and say, any questions, concerns, anything I didn't answer about joints or joint health and how that impacts you.
Do you do cortisone shots, or do you believe in that? Is that something that your company does?
That's a great question, and we do offer that. There are literature that support the use of that. Now, is that the highest recommendation from the Board of Orthopedics? The answer is no, because it's a hard to quantify benefit. But there's evidence suggesting that it works better than placebo. Even if it works the same as placebo, placebo is real, and that you can get benefit from it. The mechanism of steroid injection is that it calms the inflammation down. Okay, so when I mentioned about the whole pathway of joints being inflamed, well, the idea of the steroid shot is to calm the inflammation. Okay, some other injections you might hear of are gel injections. The idea behind that is a lubrication. Remember how I mentioned about the cartilage secreting lubrication and fluid to your knee? Well, sometimes that becomes abnormal with arthritis. The idea behind the gel injection is that it provides better cushioning and helps with the shock absorbing properties I was talking about earlier. If you decrease that shock absorbing with the gel, or decrease the pain from abnormal shock absorbing, then hopefully that'll help you with your pain. Both of those have some evidence in the literature, and that's why I tell people if it helps, great. We can repeat it ever so often. If it stops working, then it's probably not worthwhile.
Does that also work for low back, the gel?
No, not for low back, not for the gels, correct. The back is a little different beast, I should say. It's a different joint, a different type joint. I would even venture to say your hip and your knee is a little different. With the steroid shots in your hip, they also don't work that well. The knee is where it works better. With the hips, you can try it and it may provide you some relief. Oftentimes, doctors use it for a diagnostic versus therapeutic purpose, meaning that your hip could often be confused with back pain, okay, or areas of your back, low back. And so when you have a picture of, you might have back pain, hip pain, or you might have back and hip pain. Well, the shot allows us to narrow down, okay, hip is definitely part of that equation. Then we can talk about what can we do about your hip. But that's when the steroid shots in the hip could potentially offer. Yeah, no problem. Good question.
May I ask a shoulder question?
Please do. Please do.
I just received a cortisone shot 2 weeks ago. My problem is overuse, and I do some kind of sport 6 days a week.
Oh, yeah.
Sundays and day rest. And now the MRI shows tears. What is torn?
Well, it can be multiple different things. The most likely thing that you're referring to is probably your rotator cuff. When it comes down to your shoulder, rotator cuff is very, very common. It's such a painful tear too.
Yeah, they said that probably wasn't it.
They said it wasn't it.
Yeah.
Then it could be your labral tear. There's a lot of different things in your shoulder. I didn't go into depth into the shoulder anatomy, but your shoulder is much like the hip. It's like the hip of your upper body. But it's not exactly the same. You know, going back to that skeleton, the shoulder is a little different than your hip, but it's a similar idea. And there's all these muscles and tendons in there. Plus there's bursa, plus there's labrum, plus there's muscles and biceps tendon and all these different things that go through there that could impact the pain. So if they say it's not rotator cuff, the question is, is it some of these other structures?
I'm doing much better and stopping the things that hurt it.
That's right.
Now I jump on my bicycle and ride around.
Yeah.
They said I have vertical arthritis,
Oh, good.
bursitis, and tendonitis.
That's what they said. Yeah. And some of those you start with exercises, home exercises. You can even do things like if you're in the shower, just walk your hand and your arm up the shower. Try to do shoulder motion things. You don't want to get so stiff that you end up with a frozen shoulder.
Right.
That's a diagnosis. It's called frozen shoulder. You don't have that in the hip, but you have it in the shoulder where you just don't use it because it hurts so bad. And then you get like completely stiff. Sometimes that can happen in the knee. Okay, the knee, if you don't move it, the knee can also get really stiff. That's always a concern, especially after surgery. Because once that happens, it's hard to address. And that's one thing that it's called arthrofibrosis. Any other questions? Yes, ma'am.
Where's the best place to go for severe arthritis of the hands?
Yeah, that's a good question. I don't know all the hand things here. I can ask around for you. I don't know the hand surgeons around this area well. But I can tell you this. There's different types of arthritis in the hand. The hand part is not as well studied as the hip and knee. Out of all the joints, if you said which ones have the best outcome in treatments, they're the hip and the knees. Okay, hip better than the knees even. The hip replacement were called by Lance in 2007 operation of the century. Okay, you go from being so debilitated, hard to get around, hard to walk, hard to put on shoes even, and go from there, being able to do all the activities you want, go for long walks, be out with friends. So that surgery has a big change in terms of affecting your outcome. And it's a pretty big surgery, but you also get a pretty big change. That's why it's called operational surgery. The only surgery that can rival that is cataract surgery. Okay, you have a film in your eye, you can't see, you take the film out, now you can see. That's a big change. One difference is that's a minor surgery, that's not a big surgery. So with hip replacements, it does really well. Satisfaction rates with hips, they're at about 90 to 95, pretty high satisfaction rates. When it comes to knees, 80 to 85, it's a little more tricky. Knees are a little bit more tricky. But that's why I think robotics and future robotics, that's where it's at, really understanding and paying attention to certain things, okay? And that's where textbooks are written about, and this is where we have a conference.
Now, when you say robotics, are you talking about the surgical techniques?
Yes, so
Okay.
I'll dive into robotics a little bit, so that's the question. But to answer your question about hands, before I let you go on that, is hands, they're not studied as well. You know you have arthritis, but the joints, it's hard to replace them. The replacements, the joint replacement of your hand, they don't do as well. Okay, so just make sure you don't confuse my hand with some of the presentation I have today. It's a little bit of a different function. But about your question of robotics, so robotics right now, where we are, it's not, the robot doesn't do the surgery for the surgeon. If it is doing that, then you should find a different surgeon. So robotics, the way I use it is it's a tool for you. It's like if I'm going to build that table in the garage, and I could probably get 4 legs and a flat top and get it pretty close to even by just kind of eyeballing it and building it. That's like building a knee replacement. Okay, you can probably get it close if you pay attention, are diligent, not a sloppy surgeon. If you're a sloppy surgeon, it doesn't matter if it's robotics or not, you're going to have a sloppy outcome. If you're not a sloppy surgeon, you pay attention to things, you can probably build a table decently in the garage if you're, paying attention. But if you have a leveler, that green leveler, have y'all seen that thing on tube? Yeah. You put that on the table, you make sure it's level, you put it at different planes, and you check before you screw things in. Then that gives you a more reproducible outcome on a table. And that's where robotics can come in. This is the simple analogy of using robotics. Robotics can lock in the cuts that you want. Robotics can tell you the balance or give you a sense of what the balance is of the need that you're trying to look for or shoot for. It didn't tell you what you need to shoot for. It didn't tell you where you need to place the knee. It didn't tell you where to make the cuts. You still tell a robot where to set it. But you're the one, and you're also the one cutting it. The robot just locks it in. And you can adjust it as you need to. So that's what robotics is.
Can your hips actually affect your knees?
Absolutely.
A lot of people, that's what they think, it's their knee, but it's
Yes, yes, that's a great question. Your spine can affect your hip and your knee. Your hip can affect your knee. Your knee just does your knee. So yes, you're absolutely right. In fact, in my clinic, if you're seeing me in my clinic, anybody that's coming in for a knee issue gets a hip X-ray.
Okay, good.
That's right, because we say there's a high like this refer. And sometimes it's true and unrelated. You have arthritis in the hip and you have arthritis in the knee. A question I get after that is, well, which one should I address first? Do I do, like, if they're all beat up, then what do I do? I'll give you two answers to that. One is it depends. Well, the answer is it depends. But let me tell you 2 scenarios. One is they all equally hurt. They're the same, and you say they're all the same. I don't know which one to pick. Where do you start? Starting from the hip is my advice, because when you recover and rehab your knee, you have to do a lot of bending and extending of your knee to get your knee going. And if you can't rehab your knee, then your knee can get stiff, right? Well, to bend your knee, guess what happens? You have to bend your hips. When you recover your hip, you just walk. There's not a huge. You walk, you stretch, you work on certain things, but you're not depending on your knee as much. You can even keep your knee still, and you still move your hip, right? So that's why if all else equal, you start with the hip. Now there are times where you need to start with the knee first, and those are more specific, individualized situations that I go over patients in the clinic if they have specific questions about that.
I have a question for cortisone. And because I've had cortisone shots on my knees. And I've had orthopedists tell me not to do it, because the cortisone itself can affect the strength of the tendons and the muscles, is that correct?
So, the steroid itself has a cytotoxic effect on the cartilage cells. That part is correct. So the response to that is, if you have 100% healthy cartilage, i.e. if you're a 16-year-old athlete and you have knee pain or something like that, we don't give steroid shots to their knee. Now, some professional athletes will still get it because this is their livelihood, they have to do it, so they'll give them a steroid shot. We try to avoid that because it does have cytotoxic effects on the cartilage cells. It can shut down some of the cells. The cells may say, oh, this is too strong for me. You're shutting me down. You don't want me to secrete inflammatory cells, but I'm not going to secrete anything, right? So you can't shut down cartilage cells. But if you're in the category of arthritis, then your cells are already abnormal, okay? When you do the injection, now it's calming down the abnormal release of cytokines and inflammatory cells like IL-6, IL-7, all these different things that's releasing, then the steroids can calm that. Can it impact the tendons and things? No, it doesn't typically affect that in the knee or the hip. Now, if you're talking about your Achilles or certain areas, then the answer is potentially. But your hip and knees, it typically is benign on the tendon side of things. The other part about that is you have to see how long it lasts, because you can only repeat it every 3 to 4 months. That's probably something you'll hear from folks a lot. And that's because if it's not working within 3 to 4 months, it's just not working. Exactly. And it can also elevate your blood sugar. So if you're getting that, just be mindful of blood sugar. Any other questions you all have?
No, we want to thank you though.
Yeah, well, thank you.
I especially get the invitation to come back.
Oh, well, thank you. Well, I'm honored. If there's any other topics you guys are interested in, let me know. You know, a lot of things that I hit on is how do you optimize your outcomes? How do you make sure, if you do go down the route of hip and knee replacement, how do you optimize that outcome? Because, you know, the thing that hits our group the hardest is we see somebody who had their knee done by someone, right? And then they end up saying, I don't like it. And then you say, well, what did they do with it? And then it becomes a problem that's hard to solve. If you can empower yourself with knowledge beforehand and know, hey, these are the things I have to do to make sure I have the best outcome possible, and that empowers you to talk to your surgeon, whoever it might be. It doesn't have to be me, just whoever is best for you. Then you know, okay, these are the things I have to be mindful of to make sure I have the best outcome possible. And then you can ask about techniques. Well, what are their thoughts on that? You know, what are your thoughts on certain approaches? What about robotics? What about balancing? Do you do this technique or do you do that technique? These are things that most people don't know about. And some, I'll be honest with you, a lot of surgeons don't think about it because they come out of residency training, getting trained in one technique or one way, and they come out and just do that technique. And now we're starting to find out, those techniques may not be the best way. You might have to start being more critical. And that's where a subspecialty group like our group and surgeons like us will really think about it and tell you more about our philosophy.
Again, thank you so much.
Thank you guys.
Thank you.
Thank you so much. Thank you so much. Thank you.
Okay,